as planned with that. Of course, we're doing some work around just changing over to the Pfizer for those under 50 and, of course, the AstraZeneca for 50 and older. But we are on track to continue to deliver our vaccines subject to supply. So as long as the supply is here, we'll keep going, and we'll keep going at the pace we've been going.
How many days supply do we have of each vaccine?
Look, I haven't got today's update. As I say, we've factored in, our strategy has always been on average 1 to 2 weeks in supply, just to make sure we've got enough, and that hasn't deviated. So we roughly always have 1 to 2 weeks on supply.
What do you make of the Prime Minister's comment on Facebook overnight that there'd be no targets, essentially?
Look, that's a question for the Commonwealth. We've said all along that our rollout is contingent on supply. So as long as that supply keeps coming, we will keep vaccinating Queenslanders.
Are you working to any targets at the moment, or?
Well, we've already done our 1A group. We're in the stage of doing 1B. We will keep doing 1B as quickly as we possibly can, subject to supply.
Do you expect to lift those remaining restrictions on Friday?
So we're working through that at the moment. The current restrictions are in place until Thursday. We are very confident the way things are going at the moment, but of course we'll see how the next couple of days goes before we make a final decision on those restrictions. But currently they're in place until midday Thursday.
Could it be lifted earlier?
No, we've always worked on the 14 days, and that's the advice from Dr. Young, and we'll continue to do that.
Are people under the age of 50 receiving AstraZeneca in the Torres Strait?
They have been, yes, but now that we have the recommendation from ATAGU, we'll need to work through that issue.
And when do you expect that Pfizer will begin to be administered up there?
Well, what we have to do is we have to now work out how we distribute Pfizer elsewhere across the state beyond the 6 hubs that we're operating the Pfizer out of, and we need to train up our staff to do that, so they have to learn how to handle the Pfizer vaccine as well as the AstraZeneca. That's all possible. We're very confident we can do that, and we can do it successfully, and we are already putting in place those processes.
And how long do you expect that will take? Is that like 2 weeks, a month? When can we see the bigger rollout of Pfizer?
Look, we'll be working on it as quickly as possible. Again, it comes down to supply. So I understand we'll be getting more Pfizer. Dr. Young might have some more information on that, so I might just hand over to Dr. Young, but I believe we're getting some more Pfizer this week.
Yes, so we're now accelerating the rollout of Pfizer across the state. The biggest issue is supply, but I'm very confident with the Commonwealth's work that they've done, and they've said publicly that they expect to see a rapid increase in the amount of Pfizer coming into the country, so potentially double the amounts that they were originally planning for. So we'll work with the Commonwealth and make sure that as we get that increased Pfizer capacity, that we'll then manage it throughout our state, not just in those larger centres where our original plans were in place.
Will we be ready to roll out Pfizer once those extra doses come in?
Yes.
The Minister mentioned they have to be different training of staff.
Yep, but we'll roll it out where we've got staff trained. So it'll just slowly work through the state and safely.
Does it concern you that the Torres Strait had to pause their rollout, or was that the best course of action?
No, it's always important when you get more information to assess that information and work out the best way forward. So they acted very quickly, and now we'll manage that. No, we were just continuing to test her, mainly because we expected that she would become positive because of the large number who attended that particular event. Yeah. Yeah, people should always get another test if their symptoms change or their circumstances change. But if they have one test and it's negative and nothing else changes, they should be assured that that is appropriate for the vast, vast, vast majority of cases. There's always exceptions. We know that, but the exceptions are very rare.
Just in terms of the Pfizer training for health staff, are there any sort of key differences between administering that vaccine versus AstraZeneca? What are the key differences?
The key differences is the storage requirements for the Pfizer vaccine and the cold chain. They're not as difficult to manage as we were initially told because more testing's been done on the Pfizer vaccine storage, and we now know that it can be safely kept in a normal freezer for up to 2 weeks and in a normal fridge, a vaccine fridge with that usual 2 to 8 degrees Celsius temperature for 5 days. So that makes it much easier for us to be able to distribute it throughout the state. But it is still different to the storage requirements for AstraZeneca, and cold chain is critical. So the staff need training in cold chain requirements and what they need to do if that cold chain is breached. So there's that issue. Then also the Pfizer vaccine needs to be diluted in the vial before it's given, so that's different to the AstraZeneca vaccine, and the amount is also different. So it is a significantly different vaccine, which is not an issue, it just means people need training for it.
Do you know how many people have gotten the vaccine who are household members of those treating COVID patients?
No, I don't have that. That's up to each individual household. We're not mandating that requirement. We are strongly recommending it. So it's up to those people who were vaccinated in 1A because they're a healthcare worker looking after confirmed cases or working in one of our quarantine hotels to go home to their household. It's not just their family, it's anyone who lives in that household to see if they would like to come forward and get vaccinated.
And how are those people supposed to book the appointments? Because there's been some issues with online, we've been told.
Right, they can either book those appointments through their GP if their GP is providing vaccine and they're over 50, or they can go to one of their local hospital and health service hubs and get vaccinated there, or they can go to one of the Commonwealth vaccine hubs.
How many people in Queensland have received both doses of the vaccine?
I don't have that on me. You can check with the media team, they've got that information.
From the bachelorette party, how many of those people have
Well, now we've had 13 related to that cluster. Some of them were household contacts. They didn't attend the party, but the vast majority of the people who attended the party are now positive.
Have you decided whether to send all COVID patients to the RBWH?
No, we're working that through at the moment. Thank you.
everyone?